Do I use implants or fat transfer for buttock augmentation? My preference is to use the patient's own fat when I'm doing a procedure to augment the buttock. And the reason is that to place an implant in that area can sometimes be a little uncomfortable, and it's hard for patients to get used to it. The other reason is I always prefer to avoid using some foreign material when it's at all possible. When it's the person's own fat, it's actually very durable once it's established a blood supply. And after everything is healed, patients aren't aware that anything's different. You don't have issues with implant infections, malposition. Sometimes they can form what's called a capsule, which is a very tight scar around it. Fat injections don't cause any of those problems. The other thing that's great about using the patient's own fat is that because the fat has to be taken from someplace else, everything is reshaped. Putting in implants means just augmenting that one area, but by taking fat out from other areas on the body and then injecting it, the entire body is transformed. And that's what really creates a dramatic effect, and patients really love that. The placement of implants is pretty commonly done, and my preference is simply not to use them, but for some people that is the right operation. There may be some patients who just don't have any fat elsewhere to harvest, but for most people, adequate fat can be taken from everywhere on the body and injected in order to give their entire body a much nicer shape. This is Dr. Kutty, Luxe Plastic Surgery. Please call my office for any of your concerns regarding plastic surgery. Our number is 281-313-0551.